My name is Courtney Mann. I'm an assistant professor in anthropology. I'm interested in the universal components of childhood and child development. I work with two groups in the Central African Republic, and they reside in the Congo Basin rainforest. The two populations I work with have very high child mortality rates. It's difficult for, I think, anyone to understand what that means to mothers and fathers and families. One of the main goals of this project is to try to tease apart the social, environmental, and physical aspects that are influencing child health and development.
I'm Shelley McGuire, and I'm Associate Professor in the School of Biological Sciences at Washington State University. We've had a long-term interest in maternal infant health, and specifically in breastfeeding and lactation and how they influence infant nutrition and mammary health. For years, we've assumed, it's been dogma, that human milk is sterile unless it's been contaminated. And now we believe that human milk is probably the first probiotic, in that it probably introduces the baby to good bacteria from day one of life. So we're hoping that if we understand the broad community structure in milk and what makes that milk healthy, that we could produce, let's say, a yogurt or some other sort of probiotic food, a very low-cost, low-tech sort of approach that the mother could consume, influence the bacterial content of her milk, and therefore help the baby. We would definitely want to develop it in a way that it didn't need to be refrigerated. It could actually be a cream instead of a food sort of source. It's truly an international sort of scope that includes both the United States and developing countries.